Hello everyone, I'm Dr. Swapn and you're watching my YouTube channel Dental Expertise. And today I'm going to discuss about 2012 Dental PSC question paper with answer. Before that, I request you all don't forget to like and subscribe my channel. If you want to see explanation of these questions, I will share the link of PDF and video in description box. Now let's get started. The congenital absence of many teeth is termed as options are hypodontia, anodontia, oligodontia, or diphodontia. And the correct answer is oligodontia. Okay. The abnormal loss of tooth structure due to non-masticatory, non-mechanical means. Options are erosion, abrasion, atresion, or affection. And correct answer is erosion. The next question is the greater palatine foramen is located distal to the apex of maxillary. Options are first molar, second premolar, second molar, or canine. And the correct answer is second molar. Next question is which ligament is most likely to get damaged while giving an inferior alveolar nerve block injection? Options are sphenomandibular ligament, temporomandibular ligament, stylomandibular ligament, or pterygomandibular raphe. And the correct answer is pterygomandibular raphe. Which one of the following is not a characteristic of general shock? Options are increased vascular resistance, bradycardia, myocardial ischemia, or adrenergic response. And the correct answer is bradycardia. Bradycardia is not a characteristic of general shock. Okay. Next question is nerve block is induced by local anesthetic by decreasing the permeability of ion channel 2. Options are calcium ion, chloride ion, potassium ion, or sodium ion. And the correct answer is sodium ion. So nerve blocks is induced by local anesthetics by decreasing the permeability of sodium ion. Next question is how long should one wait before obtaining biopsy of an oral ulcer? Options are 4 days, 7 days, 14 days, or 30 days. And the correct answer is 14 days. We should wait before obtaining biopsy of an ulcer for 14 days. Next question is the mandibular left second molar of a 14-year-old boy is unerupted. Radiograph shows a small dentigerous cyst surrounding the crown. What is the treatment of choice? Options are surgically extract the unerupted second molar, uncover the crown and keep it exposed, prescribe an anti-inflammatory medication and schedule a follow appointment in 6 months. No treatment is necessary at this time. And the correct answer is surgically extract the unerupted second molar. Okay. Next question is osteomyelitis usually begins in the medullary bone involving options are periosteum, soft tissue, cortical bone, or cancellous bone. And the correct answer is cancellous bone. Osteomyelitis usually begin in the medullary space involving cancellous bone. Next question is what cephalometric analysis measurement is characteristic in class 1 malocclusion? Options are SNA angle of more than 84 degree, SNAB angle of less than 78 degree, ANB angle of less than 4 degree, SNB angle of less than 10 degree. And the correct answer is A and B angle of less than 4 degree. Okay. So the cephalometric analysis measurement and A and B angle or less than 4 degree is the characteristic in class 1 malocclusion. Next question is which one of the following is not the generalized cause of failure or delayed tooth eruptions? Options are hyperparathyroidism, hereditary gingival fibromatosis, Down syndrome, or rickets. And the correct answer is hyperparathyroidism. Hyperparathyroidism is not the generalized cause of failure or delayed tooth eruption. Next question is which of the following is not a functional appliance? Options are Frankel, quad helix, Clark's twin block, or Herbst. And the correct answer is quad helix. Quad helix is not a functional appliance. And other three Frankel's, Clark's twin block, Herbst are the functional appliance. Okay. Next question is a headgear appliance is used for. Options are anchorage, traction, both anchorage and traction, neither anchorage or traction, and the correct answer is anchorage. Headgear appliance is used for the anchorage. Next question is, which of the following material is not used for arch wire? Options are stainless steel, beta titanium, nickel titanium, or vitalium. And the correct answer is vitalium. Okay. Vitalium is not used for the arch wire. Which condition is appropriately treated at an early stage? Options are posterior crossbite with a functional shift, deviated midline in the absence of functional shift, mild crowding of lower permanent incisor, or 2 deciduous molar in crossbite. And the correct answer is posterior crossbite with the functional shift. It should be treated at an early age. A poor man's cephalometric analysis is performed by a. Options are dental cast analysis, facial profile analysis, photographic analysis, or full face analysis. And the correct answer is facial profile analysis. Poor man's cephalometric analysis is performed by a facial profile analysis. Next question is, which of the following would provide the most valuable information to the orthodontist in predicting the time of pubertal growth spurt? Options are a wrist hand radiograph, height weight tables, presence of secondary sexual characteristic, or stage of dental development. And the correct answer is a wrist hand radiograph is provide the most valuable information to the orthodontist in predicting the time of pubertal growth spurt. During a serial extraction case, which tooth are not typically removed? Options are primary canine, primary first molar, primary first premolar, or primary second molar. And the correct answer is primary canine. Oh, sorry. And the correct answer is primary second molar are not typically removed. Next question is, once bone formed, it grows by. Options are interstitial growth only, appositional growth only, both appositional and interstitial growth, or degenerative changes into bony structure. And the correct answer is both appositional and interstitial growth. Once bone is formed, it grows by both appositional and interstitial growth. Next question is, in which region the bone deposition is responsible for the lengthening of the maxillary arch? Options are palate, tuberosity, incisor, or zygomatic. And the correct answer is tuberosity. In the tuberosity, the bone deposition is responsible for the lengthening of the maxillary arch. Which of the following is the least important diagnostic aid in recognizing the early stage of gingivitis? Options are bleeding upon probing, gingival color, pocket depth, or stippling of the gingival tissue. And the correct answer is pocket depth. Pocket depth is the least important diagnostic aids in recognizing the early stage of gingivitis. Which of the following needs to be evident in order to make a diagnosis of periodontitis? Options are bleeding, pocket depth of 5 mm or more, radiographic evidence of bone loss, or a change in tissue color and tone. And the correct answer is pocket depth of 5 mm or more is the evident in order to make a diagnosis of periodontitis. Next question is, which of the following occlusal condition would exert lowest amount of biting force under normal circumstances? Options are complete denture resting on soft tissue, complete denture supported by implants, fully dentate occlusion, or maxillary complete denture opposing natural teeth. And the correct answer is complete denture resting on a soft tissue. Okay. Next question is, highest rate of implant failure occur in? Options are type 1 bone, type 2 bone, type 3 bone, or type 4 bone. And the correct answer is type 4 bone. In this, implant failure rate is highest. The greatest aesthetic challenge for the restorative dentist occur in the patient having a. Options are high smile line, thick periodontal biotype, high smile line, thin periodontal biotype, low small line, thin periodontal biotype, or low smile line, thick periodontal biotype. And the correct answer is high smile line, thin periodontal biotype. Okay. This is the greatest aesthetic challenge for the restorative dentist occur in the patients where high smile line and thin periodontal biotype. Which of the following condition is not a contraindication to dental implant placement? Options are diminished healing capacity of patient's issues, current chemotherapy for the treatment of cancer, advanced patient age, history of radiation therapy to the maxillofacial complex. And the correct answer is advanced age. Advanced age is a condition, is not a contraindication to the dental implant placement. Next question is, gingival fibers consist of, options are type 1 collagen, type 2 collagen, type 3 collagen, or type 4 collagen. And the correct answer is type 1 collagen. Sorry. Yes. Gingival fiber consists of type 1 collagen. Cellulocementum in contrast to acellular cementum is, options are cementum that is resorbing, newly formed cementum, that part of cementum that is adjacent to the enamel, or cementum that contain cementocytes. And the correct answer is cementum that contains cementocyte. Cellular cementum in contrast to acellular cementum is cementum that contains cementocytes. Which two bacteria are the most common bacteria in endodontic infection? Options are Porphyromonas species and bacteroids, Melaningogenica, Eubacterium and Fusobacterium, Actinomycetes and Spirochetes, Volionella and Veillonella species. And the correct answer is Eubacterium and Fusobacterium. These two bacteria are the most common bacteria in endodontic infection. Which of the following are not found in the pulp? Options are reticulin fiber, collagen fiber, proprioceptor nerve fibers, or myelinated nerve fiber. And the correct answer is reticulin fibers. Reticulin fibers are not found in the pulp. Next question is, the absence of which layer of dentine predisposed to it to internal resorption by cell present in the pulp? And the correct answer is predentine. Okay. Predentine, in the absence of predentine, there may be internal resorptions. Okay. Which of the following is the most accurate definition of phoenix abscess? Options are an acute apical periodontitis, a suppurative apical periodontitis, an acute exacerbation of a chronic apical periodontitis, or a chronic state of an acute apical periodontitis. And the correct answer is an acute exacerbation of chronic apical periodontitis is the definition of phoenix abscess. Next question is, a patient present with an acute periapical abscess, which of the following test would have a positive response? Options are hot test, electric pulp test, cold test, or percussion. And the correct answer is percussion. Percussion test shows positive response when a patient present with an acute periapical abscess. The ideal amount of dentine required between an amalgam restoration and the pulp for insulation is, options are 0.5 mm, 1.0 mm, 1.5 mm, or 2.0 mm. And the correct answer is 1.5 mm. 1.5 mm amount of dentine required between the amalgam restoration and the pulp for insulation. Delayed expansion of amalgam restoration is most likely to be associated with, options are over trituration and condensation, high residual mercury, the contamination of amalgam by moisture during trituration and condensation, or failure to use cavity varnish. And the correct answer is the contamination of amalgam by moisturizing during trituration and condensation. It causes delayed expansion of amalgam restoration. Which tooth requires special attention when preparing the occlusal aspect for restoration? Options are mandibular first bicuspid, mandibular second bicuspid, maxillary first molar, or maxillary first bicuspid. And the correct answer is maxillary first bicuspid. Is require the special attention when preparing the occlusal aspect for restoration. Next question is, when removing caries, which of the following layer of dentine are affected but not infected and therefore do not need to be removed? Options are turbid dentine, transparent dentine, subtransparent dentine, or infected dentine. And the correct answer is subtransparent dentine. Subtransparent dentine is the layer of dentine are affected but not infected, therefore do not need to be removed. The initiation of dental caries require a high proportion of lactobacillus within saliva, lactobacillus within dental plaque, streptococcus mutans with dental plaque, streptococcus mutans within saliva. And the correct answer is streptococcus mutans with dental plaque. It has the high proportion for the initiation of the dental caries. On your crown insertion appointment, you notice that the margins are open when you attempt to seat the crown in mouth. Which of the following should you check first? Options are the proximal contacts, the occlusal contacts, for a void on the crown interior, for a nodule on crown interior. And the correct answer is the proximal contact. On the crown insertion appointment, we should notice the proximal contacts. A sedative often used in management of anoxious pediatric dental patient is. Options are pentobarbital, secobarbital, chlorhydrate, or mepridine. And the correct answer is chlorhydrate is the sedative often used in management of anoxious pediatric dental patient. Okay, तो आज का वीडियो हम यही एंड करते हैं एंड नेक्स्ट वीडियो विल कंटिन्यू after question. I'll start with the question number 41. If you like my video, please like and subscribe my channel. Thanks for watching.